In 1861, Dr. Joseph Lister realized that about 45 to 50% of his amputee patients died due to sepsis. In 1865, he learned about Louis Pasteur's famous research around germs. Implementing that, he was able to cut his mortality rate down by 75% by washing his hands. Medical organizations have been focused on being hygienic since way before COVID-19 and way before it was cool. Why is this relevant? Well, 54% of medical organizations are worried that there will be low patient demand when they reopen. So, make sure that you tell patients about your commitment to being clean and the history of your organization and medical organizations everywhere. Hygienics is very important, and no one knows that better than you, since you've been doing it for so long. It's a core competency you have. Make sure in your social media, your website, even press releases, that you make sure patients feel assured. And they should. Again, you've been doing this since before it was cool. Every customer we're talking to is seeing record demand with phones off the hooks. While I don't think low patient demand is going to be a problem, for those that do, that's a strategy. Thank you. Have a great day.